Hello viewers and listeners, we are Group 8 and we will be presenting on arterial blood gas. I am Kimberly Miller.
And I am Prince.
I am Michelle Martin.
I am Kira Daly.
And I am Ashana Swaby.
Good morning. Somebody.
Good morning.
Good morning. How can I help you today?
My dad has been feeling short of breath last night, and the doctor at the clinic told us to come and get a blood gas test.
Okay, I understand. We'll get her checked in. Could you provide me with her name and her date of birth, please?
Date of birth name?
Kira Daly, July 12, 2007.
Okay. So thank you, Kira. Please have a seat down here, and the nurse will call you shortly for your arterial blood gas test.
Okay, cool.
Kira Daly, come in. So good morning. Good morning, nurse.
Good morning.
Please have a seat. Thank you. The doctor said we're supposed to get it. Okay, so Kira, how are you doing today?
I'm fine.
Okay. Your doctor ordered an arterial blood gas to check how well your lungs are moving oxygen into your blood and removing carbon dioxide. Have you ever had this test before?
No, because I'm hot.
No. Could you please place your hand on the table? So you might feel a brief sharp pain when I place the needle in yours, but don't worry, I'll be as gentle as possible. And I'll also hold pressure on the side afterwards to prevent it from bruising. Okay?
Okay.
It can be dangerous? No. Some people might feel a little lightheaded afterwards, but don't worry, we'll monitor her closely. Okay, alright.
When taking an arterial blood gas, the first thing the provider does is perform an Allen test, where the patient must put their hand in a tight fist and hold it. The provider will then press on each side of the wrist while the hand is still in the fist position. After, the patient relaxes their hand while pressure is still being applied and the return of blood flow in the hand is observed. The provider then assesses the course of the radial artery and the site of injection is cleaned for 30 seconds. The needle is inserted at a 45-degree angle and the syringe is allowed to self-fill. After the needle is removed, immediate pressure should be applied to the site.
Are these the ABG samples from room 3? Thank you so much. I'll run the analysis and send the results right over to Dr. Miller.
Good morning. Are you Kira Daly?
Yes.
Okay, follow me and have a seat. Please close the door. So Kira, it's lovely having you back. Well, not too lovely because you're ill, but it's good seeing you. So the last time we met, I sent you to do an arterial blood gas test. Am I correct?
Yes.
So I'm assuming that you're back here with the results. So can I have it, please? Okay, so that's the results. Okay, so from viewing your arterial blood gas test, it's telling me that your oxygen levels are a bit low while your carbon dioxide levels are elevated. They're slightly elevated. So that helps me and you to understand why you're feeling short of breath.
So Doc, what will happen next?
So what will happen next is we're going to put her on some oxygen and monitor her breathing. The test helps us to see that your lungs are functioning, but not too well. But when you get the oxygen, then it will gradually normalize. Okay, so that's about it for your test.
Thank you, doctor.
You're welcome. So we keep a close eye on your progress, and in the event that when you go back to the hospital and the oxygen doesn't work, you can come back and see me and we'll take it further from there. But I trust that you'll be okay.
The results of my patient's ABG test are as follows. The pH is 7.38. The partial pressure of carbon dioxide is 48 millimeters of mercury, and the partial pressure of oxygen is 68 millimeters of mercury, and the bicarbonate level is 24 millimoles per liter. The patient's slightly elevated carbon dioxide pressure within the blood indicates mild hypercapnia. The low oxygen levels within the blood of my patient indicates mild hypoxemia. The pH within the blood of my patient is slightly alkalotic, but overall, the picture is consistent with mild respiratory impairment. The low oxygen levels and slightly elevated carbon dioxide level suggest that my patient's lungs are not exchanging gases as efficiently as they should, and as such, the solution for this issue is to provide oxygen therapy and closely monitor my patient's clinical status. An arterial blood gas is a test that measures the oxygen and carbon dioxide levels as well as the pH balance in a blood sample obtained from an artery. An arterial blood gas test is usually done for patients with severe respiratory, cardiac, and metabolic problems, acute respiratory distress syndrome, COPD, and heart failure. Patient intake. For a patient doing an arterial blood gas, they have no dietary restriction, there is no need for them to go on fasting, and they have no medication requirements, but they must inform their doctor of any medication they are taking, in particular blood thinners, as they can increase the risk of bleeding during the procedure. Sensitization. The healthcare provider will need to educate the patient on what will be done during the procedure beforehand. This includes why the arterial blood gas is needed, what happens during the procedure, and that there might be a slight discomfort that accompanies the procedure. When this is done, the chances of patient cooperation increases. Assessment. The provider will need to assess the intended puncture site to check if there is adequate blood flow, if there are any burns, scars, or infections, if there are bleeding risks such as low platelet count, or if the patient has any clotting disorders before proceeding with the exam. Medical history. Before the procedure, the provider will review the patient's medical and treatment history. Some examples of the review include oxygen therapy and ventilation status, respiratory and circulatory symptoms, vascular health of the intended limb, and bleeding disorders or medication. Proper positioning. Patients are usually placed in a comfortable and stable position. This could be sitting upright in a chair or laying supine if they are weak, unconscious, or unable to sit. Note that the arm is usually positioned at the heart level to avoid altering arterial pressure artificially. ABG samples must be collected in a pre-heparinized syringe to prevent clotting, as small clots can block the analyzer and distort gas measurements. If analysis will not take place within 15 minutes, the sample should be placed on ice at 0 to 4 degrees Celsius in order to reduce cellular metabolism. Air bubbles must be removed and the syringe sealed immediately to prevent inaccurate readings of an increase in PaO2 or decrease in PaCO2. To prevent clot formation, the syringe must be rolled gently or inverted after collection to mix blood with heparin, which therefore prevents clot formation.
In arterial blood gas results, it is important to begin with pH. The normal pH range is 7.35 to 7.45. If a person's pH is below 7.35, then that means the person has acidemia, which is when there's an excess of acid in the blood. If the person's pH range is above 7.45, then this means that the person has alkalemia, which means there is a loss of acid in the blood. It is important to assess the PaCO2, which is the partial pressure of carbon dioxide. The normal range falls within 35 to 45 millimeters of mercury. If there is an elevated PaCO2, then this means that there is respiratory alkalosis. Whereas if there is a reduced PaCO2, then that means there is respiratory alkalosis. Next, an assessment will be made on bicarbonate. The normal bicarbonate range falls within 22 to 26 milliequivalents per liter. When bicarbonate is low, this signals respiratory acidosis, and when it is high, this signals respiratory alkalosis. If the problem is respiratory, where the partial pressure of carbon dioxide is abnormal, then the kidneys will try to fix this by adjusting bicarbonate levels. And if the problem is metabolic, where bicarbonate is abnormal, then the lungs will try to fix this by adjusting PaCO2 levels or partial pressure of carbon dioxide.
The significance of ABGs to health. Arterial blood gases are vital because they give immediate, accurate information about how well the lungs and kidneys are working to maintain the body's acid-base balance. They show whether a patient is getting enough oxygen, removing carbon dioxide properly, and keeping a normal pH. This makes ABGs essential in diagnosing and managing conditions such as respiratory failure, asthma attacks, COPD, shock, diabetic ketoacidosis, kidney failure, and severe infections. ABGs also guide treatment decisions like whether a patient needs oxygen therapy, mechanical ventilation, fluid correction, or medication to restore balance. Overall, ABGs play a critical role in monitoring critically ill patients and preventing complications.
Don't be afraid, my friend. I'm gonna prick you with precaution. Don't be afraid, my friend. Go on, listen up. Gather round that me I got talk about a test. Day and night, arterial blood gas it. Check your state. If you're feeling faint, don't hesitate. Nurse is skilled with gentle touch. Collect the sample with precision clutch. Lab analysis, it's swift and true. Results unfold like story anew. Doctors decipher the code so fine, interpreting results with expert design. Acidosis, alkalosis, a snapshot of felt in moment 1 or 2. Proper care, a patient's right, monitoring day and night, oxygen therapy supporting life, results guide the medical crew. Adjusting treatment with precision through a delicate balance, a vital sign, arterial blood gas, a diagnostic text divine. In the ICU, a critical test, life-saving decisions, no time to rest. Sepsis shock, the ABG brings hope to life. The numbers dance a rhythmic beat. pH, PaCO2, PaO2, HCO3. A symphony of acid-base control, a delicate balance of the body's soul, interpretations key in the doctor's hand, a diagnosis, a treatment plan, a patient's future in a crucial stance. So let us praise the wondrous test, a tool of feeling, a gift to the best, arterial blood gas, a diagnostic gem, a shining star in the medical hem. So don't be afraid, my friend. I'm gonna prick you with precaution. Don't be afraid, my friend. I said, don't be afraid. Don't be afraid, my friend. We are here to help. Don't be afraid, my friend. We proceed with care. The ABG test will show us what's there. The arterial blood gas, a vital sign. Checking pH year 202. Don't hesitate to align. So don't be afraid, my friend. We're gonna prick you with precaution. We care. We hear. So don't be afraid, my friend. We care. We hear. Don't be afraid.